Hello everyone, I'm Dr. Upasna Saxena. I'm a senior consultant in the Department of Radiation Oncology in HCG Borivali. And I'm here to talk to you about esophageal cancer awareness. To begin with, what is esophagus? It is the food pipe that leads from the mouth, the lower part of the throat, till the stomach. That is known as a food pipe. It's a tube which is made of muscles, and of course it has other layers over it. This helps propel the food. When we swallow, the muscles push the food down into the stomach. So a tumor arising in this is known as esophageal cancer. There are different types of esophageal cancer. The most common ones are either squamous cell cancer or adenocarcinomas, or a mixture of both. There are some unusual variants as well. Now, what are the most common causes that lead to the development of esophageal cancer? Sadly, we do not have a way in which we can prevent esophageal cancer very directly, like a vaccine or anything, but we can control many risk factors. The most common and important risk factors for developing esophageal cancer are smoking and alcohol consumption. Drinking very hot liquids, which is leading to continuous trauma or continuous damage of the esophageal mucosa, leading to development of cancers. These are very common things which we can actually control. Apart from that, having a properly balanced diet with fruits, vegetables, having proper minerals is going to be preventive. It is important to not consume too many chemicals, because there are substances which have hydrocarbons or certain other substances, and those chemicals can actually lead to the development of cancers in the esophagus. These are things we can actually control, we can regulate. There are certain other factors like presence of Plummer-Wilson syndrome, which we cannot regulate. There are certain areas geographically which have this cancer more. Apart from that, there is also a condition which is known as gastroesophageal reflux, where acid actually rushes into the food pipe. So people who experience this know that it's a very, very uncomfortable situation. Now the problem with that is not just that moment, but this kind of acidic trauma to the esophagus can lead to the development of esophageal cancer. So anybody who suffers from reflux should meet a gastroenterologist and get it resolved, because that has increased risk of developing esophageal cancers. Now, once esophageal symptoms come in, we need to evaluate. So what is it that you need to be aware of? How do you suspect that there could be something in the food pipe? Swallowing difficulty is one of the most common presentations. It can begin with difficulty in swallowing solid foods, and then it progresses on to liquids. Or there could be a sense of discomfort or pressure or slight pain in the chest when trying to swallow food. There could be pain in the area of chest or radiating to the back. There could be unexplained weight loss. There could be a loss of appetite. There could be nodes or small nodules or bulges that one can feel around the collarbone area. These are most commonly things that, as a patient or as a person, can make someone suspicious that there is something wrong. Now, these symptoms could be due to other conditions as well, but that we would only know after we evaluate. So do not evade if you see any of these symptoms. When you go ahead for evaluation, the tests include starting with a barium swallow. If the barium swallow shows a lesion, the patient is made to drink a contrast and an X-ray is taken. So if there is any tumor in the esophageal lumen, we are able to see it. Once that is there, we need to evaluate further by looking at it endoscopically, taking a biopsy, doing radiologic investigations like a PET CT scan, preferably, or else a CT scan. MRI shows us the depth of the involvement within the esophagus. So post these investigations, we are able to take a call what is the extent of disease, whether it's located at one place or it has spread to other parts of the body. Basis that, treatment decision is made. Now, treatment can be a combination of multiple different modalities like surgery, radiation and chemotherapy. For a tumor that is located in the upper esophagus, just in the beginning part of the esophagus, radiation and chemotherapy alone would be enough. But as we move lower down, when we have more critical structures, if you go to the lower esophagus situated right behind the heart, or maybe adenocarcinomas, which are more common, it is preferable to combine surgery with either chemotherapy or chemoradiation given prior to surgery, might need additional later. So this way there are combinations of different treatment which are offered depending on the different details of the tumor, its location and its extent. So long ago, the survival and the cure rates with carcinoma esophagus was very poor, but now we have better control rates, we have better medicines, we have less invasive surgeries, we are able to increase the dose that we deliver in radiation, which we were not able to do with older machines. Radiation can be delivered in two formats. One is the external beam radiation and the other is brachytherapy, that is intraluminal, where a small radiation source with the help of an endoscopically guided tube is directed to deliver dose to the tumor without delivering dose to other organs around. So there are multiple ways to treat esophageal cancer. One must always be aware, because this is the organ which is located inside the body. So it's only if you're very aware you'll be able to catch it early. And since it's an aggressive disease, catching it early is very, very important in a good cure rate. So I hope that you would bear all these things in mind, try to cut off the risk factors from your lifestyle and be aware of any symptoms that you experience and be evaluated. Together we can do it. First time, the right way. Thank you.